We are May 17, and today we celebrate global vascular Ehlers-Danlos syndrome, one of the forms of EDS with the more dangerous symptom. To bring awareness to the subject, I'm wearing red today, and I'm gonna tell you some information about this condition. But first, if you don't know me, hi, I'm Corey, and I'm from Switzerland, and usually speak French, which explains my accent. I also have hypermobile Ehlers-Danlos syndrome, the most common type of this connective tissue disorder associated with a lot of symptoms. Most of the time, the hypermobile type has less serious symptoms than the other type of EDS. Of course, I'm speaking in general, not for every actual case. The lack of awareness of Ehlers-Danlos syndrome, including the vascular type, makes patients with this condition more at risk to have health complications, sometimes lethal. And that dangerosity is especially important with this type of EDS, where patients have an average life expectancy of 51 years old. However, early diagnosis and appropriate care can make a huge difference and thus allow people to live a longer life. We refer to vascular Ehlers-Danlos syndrome as VDS for short. You can also find it with the name type 4 Ehlers-Danlos syndrome in previous diagnosis criteria. This is a rare condition, and it is estimated that between 1 to 50,000 people and 1 to 200,000 people have vascular EDS. VDS is genetic and transmitted by autosomal dominant way, which means that if only one parent has the affected gene, their children has each 50% chance to have that condition. Evocative symptoms of vascular Ehlers-Danlos are a family history related to this condition, arterial ruptures or dissection before the age of 40, sigmoid colon rupture without explanation, or pneumothorax without explanation. Added to other characteristic symptoms of VDS, doctors should search for this diagnosis with genetic testing. Other minor criteria have to lead the doctor to search for VDS as well. Vascular Ehlers-Danlos syndrome can be confirmed with genetic testing finding mutation in the COL3A1 gene in collagen 3. This is the international recommendation for the diagnosis of vascular Ehlers-Danlos syndrome, and 95% of the patients with this type of EDS could be diagnosed that way. But since there's still a minority where the genetic testing don't conclude to a VDS diagnosis, and in case where there's no other condition that could better explain the symptoms, the French association GERSED, which stands for Study and Research Group for Ehlers-Danlos syndrome, stated that in absence of mutation COL3A1, the diagnostic shouldn't be ruled out in patients matching the clinical diagnostic criteria. Two major criteria or a combination of major and minor criteria should be enough to give the diagnosis. The major criteria are a family history of VDS with COL3A1 mutation, an arterial rupture at young age, unexplained sigmoid colon rupture without another condition that could better explain it, a uterine rupture during the third trimester of pregnancy without previous cesarean or severe perineal damage, and the formation of an arteriovenous fistula without damage. For the minor criteria, we have ecchymosis without trauma who could explain them or in strange location like in the back or the face, a very thin skin where we can easily see the veins under it, facial feature of VEDS, who can include prominent cheekbones and sunken hollow cheeks, sunken eyes, a thin pinched nose and thin lips, and a more useful appearance who is sometimes called Madonna facies. A spontaneous pneumothorax, the skin of the hands and feet who age prematurely, a clubfoot, a congenital luxation of the hip, hypermobility localized in the small joint like the hands, tendons and muscle rupture, a keratoconus, fragility and gingival recession, and varicose veins without explanation. The diagnosis of vascular Ehlers-Danlos syndrome is crucial to adapt the healthcare, the quality of life, and give patients the best chance of a long life. People with VEDS are at risk of sudden death due to arterial rupture. There's also risk for pregnancy and delivery, where the help of a geneticist and a competent trained medical team is needed to be sure that everything goes the best way possible. For surgeries or some specific medical intervention, Doctors would have to be more careful and adapt their technique and their material to assure the best result possible. Like every type of EDS, delay of diagnosis is important. And due to the seriousness of the symptoms in their form of EDS, it is really important that we advocate in order to give VEDS patient early diagnosis and appropriate medical care. In a retrospective questionnaire of 220 VEDS patients, 80% of them had at least one complication of this form of EDS before the age of 40. That's a lot. The differential diagnosis of vascular Ehlers-Danlos syndrome include, and I'm sorry for the pronunciation, Loeys syndrome, Stenoxanthoma elasticum, and Marfan syndrome. Other types of Ehlers-Danlos can have similar symptoms, and if the mutation of the COL3A1 gene is not found, genes mutation for the classical type, the kyphoscoliotic type, and the parodontal type should be explored. So today, I invite people to wear red for VEDS, to bring awareness on your day-to-day life and on social media to this condition, to repost content about vascular Ehlers-Danlos syndrome, and to use the hashtag #RedsForVEDS. If you think you might have this form of Ehlers-Danlos syndrome, I would suggest that you contact a geneticist, since they are the one able to search for the COL3A1 gene mutation and look for a differential diagnosis if necessary. If you stayed until the end of this video, I challenge you to comment with a red heart that we give to all the vascular EDS patients out there. Let's have spoons, everyone. Bye! Right. Is it enough to give the diagnosis when the genes don't match? Is it enough to give the diagnosis when the genes don't match? What am I gonna do with you, my little one? Hello. Hello. Give me a kiss. Hello. Are you bored? Are you not born to be pet? Okay, you wanna play now? This is my fault, right?